the consequences of this vacancy on the direction of the country could be huge, because if you fill this vacancy, Obamacare is likely dead. So where is your plan to replace it?
So the president has taken a number of steps in the healthcare space. I would not agree, by the way, with your premise on hypocrisy, but we've gone through that. So I'll move on to your healthcare question. But with respect to Obamacare, the president is committed to protecting pre-existing conditions. He's alluded to his executive actions he can do in that regard. He has also taken a number of steps already on reducing drug prices, on making different types of plans, more affordable plans, available to the American people, like association health plans. He's made telemedicine more available. So he is about reducing costs, expanding access, especially with the measures he's already taken. And he has said in the media in recent weeks that he will have more to say on health care as well. But he is 100% committed to protecting pre-existing conditions.
People are already voting. Where is the plan?
He has said, I mean, the people can get a pretty good preview of the way the president views healthcare in this country and on how to expand access and reduce costs, because he's taken a number of steps already. He will take a number of additional steps that
Brian,
he will outline very soon.
Listen, that's not that. Let's listen to what he said less than a week ago. This is what he said about having a plan ready.
You've been promising a new health care plan. I interviewed you in June of last year. You said the health care plan would come in 2 weeks. You told Chris Wallace that this summer it would come in 3 weeks. You promised an executive order on pre-existing.
I have it already.
But you've been trying to strike down pre-existing conditions.
I have it already, and it's a much better plan for you.
It's all ready. That was 6 days ago. Where is the plan, Brian?
The president will roll it out when he's ready to do so, but it will focus on expanding access, reducing costs.
Wait, no, Brian, it doesn't matter where is the plan? We're 6 weeks from the election. He'll roll it out when he's ready. People are already voting. He's been promising this over the summer. He's been promising this for years. He's asking the Supreme Court in a moment that it will get soon to get rid of Obamacare. He has to have something to replace that if he's going to make good on his promises. Where is the plan?
He has already eliminated the individual mandate. He has already lowered prescription drug costs. He has already expanded health care options and insurance options. He has already expanded telemedicine. He'll have more to say on the subject very soon. I understand
people with pre-existing conditions. No, people. Well, there is no plan. These are executive orders. And on the issue of pre-existing conditions, this isn't when the president is talking about a plan. It seems to be that he's talking about a comprehensive plan. People are concerned. You heard this last week from voters. They're concerned about their pre-existing conditions. You're looking at an estimated 12 million people during this COVID pandemic. It becomes increasingly important who may be losing their employer-provided insurance. So where is the plan that they need and that they should have if we listen to what the president has said? Where is the plan?
Well, I appreciate your persistence. You've now asked me the same question a number of times, and I will give you the same answer.
I've gotten the answer no times. I've not actually gotten an answer. That's why I'm asking again, Brian.
Issue a more comprehensive view, but you can, as I've said, you can get a preview already from the many comments that he's made and the many actions he has taken. He is committed to protecting pre-existing conditions. He is committed. He has already lowered costs. He has already expanded access.
When will he release the plan? Brian,
he will release it very soon, Brianna, and he will discuss it with the American people, and he'll be very transparent.
He's been promising very soon, and he's blown past his own deadlines. Before the election?
He will be very soon. He'll be very transparent on this policy, as he is with all of his other policies. The American people will never have to guess where President Trump stands on a very important issue.
They will certainly have to guess where he stands on this issue. Let's listen to what he has said over the summer about the timing of his plan.
We're signing a health care plan within 2 weeks, a full and complete health care plan that the Supreme Court decision on DACA gave me the right to do. So we're going to sign an immigration plan, a health care plan, and various other plans, and that the Supreme Court decision on DACA in the next 4 weeks. I do want to say that we're going to be introducing a tremendous health care plan sometime hopefully prior to the end of the month. It's just about completed now. So over the next 2 weeks, I'll be pursuing a major executive order requiring health insurance companies to cover all pre-existing conditions for all customers. That's a big thing.
I'll ask you again, Brian. The plan is long overdue. Why is the plan not out?
Brianna, it'll be out very soon. I don't know if you expected me to bring it with me here to this interview, but the president will release it on his timeline very soon, and he will focus on
Brian,
reducing
he's not
costs, expanding
Brian,
access.
to be clear, Brian, he put his timeline out there. That's completely false. What you're saying, he's not releasing it on his timeline. He's blown past his timeline. I mean, is there even a plan?
It's his timeline. So there is a plan. He will describe it clearly to the American people. It will reduce costs and expand access and protect pre-existing conditions. And the American people will have a very good look at it, and they'll be very pleased with it.
How is he going to...
That gave me enough time to fix whatever was going on with my camera. The Republican Party does not have a plan. Let's be sure about something. The Republican Party does not have a plan for replacing Obamacare. All they had was the ability to repeal it. They could break it apart. They did all these things to tear down Obamacare, but they had nothing to replace it with because Obamacare is a free market solution. They call it socialized medicine, but it most certainly is not. It is a free market solution that actually came from the Heritage Institute, the Heritage Foundation, and was first put into motion by Mitt Romney, a Republican. So what President Obama did with Obamacare was he co-opted a conservative piece of legislation. And because of that, Republicans do not have anything else to offer except their desire to repeal Obamacare at all costs. And this is literally why you will not get a plan from conservatives. They had years. They had all 8 years of the Obama administration to come up with a plan. They had the House, the Senate, and the White House between 2017, and 2018. They tried to repeal portions of it. John McCain saved the day when he came in with his thumbs down. But they do not have a plan because they ideologically cannot go any further right than Obamacare and offer something to the people that's a sufficient replacement for Obamacare. They are not going to give us Medicare. There are other plans out there, mind you. There are literally other plans out there that would be better for America than Obamacare. But they are not going to give us Medicare for all, which would be better than Obamacare. But since they won't give us Medicare for all, and they can't do anything better than Obamacare from their ideological perspective, that's why they don't have a plan to offer us. And that's why he couldn't answer her question, no matter how many times she asked him the same question over and over and over again. So good luck, Republicans. You're not going to have an answer to that because you don't have an answer to that because Obamacare is a free market solution for health care. I don't actually agree with it. I prefer Medicare for all. But to be sure, to be certain, Obamacare is better than what President Trump is trying to offer, which is literally nothing. He's trying to take away the protections that Obamacare gave. I was on Obamacare 1 year and it was better than not having insurance at all. It's still not affordable for some people, specifically because of the way that Republicans have undermined it at every single stop. They would not do the Medicaid expansion across several states. And in those states specifically, the premiums went up tremendously. So it's like Republicans, this is what they do. They break a piece of legislation and then they turn and say, hey, look, it doesn't work. And that's what Donald Trump is trying to do here. So he doesn't have a plan. He won't have a plan. He's trying to wait till everybody forgets it in the news cycle.